TCO alarms in your home. Protect your family today.
You're watching Rogers TV, Barrie.
The Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So as of today, we've had a total of 13,709 cases. This is up 144 cases over the past week, 31 cases through the weekend from October the 10th. So this is actually the first time in 5 weeks that we've had an increase in case counts 1 week versus those that preceded it. So we've had a 35% increase in local cases. If you look at the week of October the 3rd to the 9th, a total of 132 cases compared with 98 cases the week before. So in fact, that number, 132, would take us back to being slightly less than the number of cases that we had during the week of September the 12th, mid-September. Obviously an important question would be the significance of this. We certainly want to see cases continue to come down or at least stay the same. So going up, I think, is a cautionary note for us. And we'd want to understand more why this would be. So in looking at some of the details of the cases, we note that we actually have some reduction in the proportion of them that are community cases that are not linked to anything that we could identify. So 19% of those, whereas preceding that, it had been about a third of our cases that had been unlinked to other known cases. We note that 72% of our cases were unvaccinated. We also note that 31% of our cases were children less than 12 years of age. So they cannot be immunized. They have remained a vulnerable group through the pandemic, but in particular during this fourth wave, we've seen a higher proportion of our cases being among children and among other people who are not immunized. When we look at the cases that have occurred among those who are less than 12, they total 41 in all in the past week. So 31% of all of our cases is 41 cases. Most of them are actually related to outbreaks. So the outbreaks that are happening in our schools, 63% of the cases have been associated with those outbreaks. So 26 of those cases, in other words. 32% of the cases have been close contacts, household contacts mostly, or with a friend. We've otherwise had a very limited number of cases, 5% that were associated with travel. So the pattern that we see would be some of this increase may very well be due to children, some of it related to outbreaks in schools in children, and otherwise transmission in the household. We have an increase in the number of our active cases, so 153 active cases up from 131 the preceding week. And very sadly, we have had a death in the past week. This is a woman between the ages of 45 and 64 living in Simcoe County, not linked with an outbreak, so a sporadic case, and unvaccinated. And certainly I want to express my sympathy to the family members for your loss. We have 10 individuals, residents of Simcoe Muskoka, who are hospitalized. This is up from 6 a week ago, 3 in the intensive care unit, down from 4 a week ago. And their ages range from in their 20s to their 70s, all of them in Simcoe County. 5 of them were community acquired, which means we don't know exactly how they occurred, how the transmission happened. 3 were close contacts of a known case. 1 was part of an outbreak, and 1 is under investigation. 8 of them were unimmunized, 2 were immunized, all fully immunized, and all those in the intensive care unit were unimmunized. We've had 13 cases in the last 24 hours, 12 of sporadic, and 1 was related to an outbreak. 10 male, 3 female, ages ranging from less than 10 to in their 60s. 11 of the 13 were under the age of 50, and 4 of the 13 were children under the age of 18, so all living in Simcoe County. In terms of acquisition, 6 are under investigation. 1 was a close contact of a case, 4 were community acquired, 1 was outbreak related, 1 was travel related, and all are self-isolating, not admitted to hospital. 9 were unimmunized, and 3 were not eligible to be immunized, and 1 was fully vaccinated. Most are the parts of Simcoe Muskoka that are most active with regards to cases are South Simcoe. So Bradford, West Gwillimbury has the highest weekly incidence of cases, 55 per 100,000 population per week. New Tecumseth, Orillia, and Innisfil all have had weekly incidences above 30 cases per 100,000 population per week. And for Simcoe Muskoka as a whole, we have 22 cases per 100,000 population per week. And this is, as I said before, 35% higher, up from 16 cases per 100,000 population per week in the preceding week, and a little bit lower than the province at 26 cases per 100,000 population per week. I note that we're coming close to the provincial rate. And this is unusual for us. Through most of the pandemic, we've been riding at about half of the provincial rate. So earlier in the 4th wave, we were close to the provincial rate. We find ourselves again close to the provincial rate. 100% of our cases in the past week were due to the Delta variant, in keeping with what's happening across the province. We have 4 ongoing outbreaks, down from 5 a week ago. So they're as follows. 1 in a congregate setting, a group home in Simcoe County, and 3 of them in schools in Simcoe County. The largest one having 20 cases, up from 12 reported in the preceding week. And we've had 1 outbreak declared over, and that was in a school in Simcoe County. And so if we look at our school outbreaks, which are figuring very prominently among outbreaks in the 4th wave, we've had 8 outbreaks to date, all of them in elementary schools, 5 of them over and 3 of them ongoing. All of them have been among students, without staff being among the cases. And we've had a total of 49 cases, if you tally all of the cases, 49 cases associated with school outbreaks since September of this year. If we look at immunization, we continue to make progress. We are presently up to 86% of our eligible population 12 and above have received 1 dose, and 81% have received 2 doses. This is 1 percentage point behind the provincial average for both of those figures. And just to give context, the provincial goal is to achieve 90% coverage for 1 dose and 2 doses. So we continue to make progress, though this is the last mile, and rate of vaccination is much slower than it had been in the summer when we had the mass immunization clinics underway. We continue with the lowest coverage of immunization among young adults, 18 to 29 years of age, and in particular, young men. One thing I would note is that our data shows the effectiveness of immunization. For those who are unimmunized, they are 11 times more likely to contract COVID-19 than for those who are fully immunized. And by our local data, also 35 times more likely to be hospitalized with COVID-19 compared with those who are unimmunized. So we continue with our vaccination clinics. We have been taking advantage of the GoVax mobile bus unit provided by the province, and they've been holding GoVax events, and we've also had pop-up clinics. So we've had 18 GoVax events in Simcoe County since September, vaccinating 1,356 doses, providing those doses. And we've had 45 health unit-led pop-up clinics in Simcoe, Muskoka since September, providing 3,762 doses. And we have continued with school clinics. They ended last week. So since the beginning of this year, we hosted 18 school clinics with 2,177 doses administered. In terms of our dashboard, we remain in yellow status, viral spread and containment in yellow status, laboratory testing in green status with regards to a low percent positivity of 1% and a fast turnaround time, meeting the goal of 70% tests reported within 1 day, 80% within 2 days. The health system capacity is in green with regards to bed occupancy. Public health system capacity is in red, although improving. This is with regards to the percent of our new cases reached within 1 day. At 86%, our goal is 90%, and this is up from 76% a week ago. And follow up with the contacts of the cases, 79% within 1 day, up from 70% a week ago. We've had questions with regards to the definition of a school or childcare setting outbreak. And so it is as follows, in keeping with provincial direction. We would declare an outbreak in these settings if we've had 2 or more cases within a 14-day period that have been confirmed with laboratory testing and have a link of some kind, evidence of transmission on site related to these cases, rather than having contracted it in the community and having been at the site but not leading to transmission. And certainly, we determine this through careful history taking of the cases and follow up with their contacts to find any such evidence. Certainly, it's important at this time to advise people of the need for everybody to participate in all that's needed to keep these environments safe. So first and foremost, I advise everybody who's eligible to receive their vaccine to protect themselves and to protect family members and to protect people who cannot be immunized. So children under the age of 12, at this point in time, we're not able to immunize them. It's really important that everybody around them be immunized. Also, they need to be screened daily before going to day childcare or school for symptoms, and withheld from going if they have symptoms or if they're identified as a contact of a case or possible case, and to be assessed and tested. There's a requirement for mask use, hand hygiene, physical distancing where possible, staying within cohorts in the school environment where possible, and disinfection within the facility environments. So when we're investigating an outbreak, as indicated, we receive the laboratory tests. We contact the individuals who are positive with these tests in order to gain a detailed history about how they may have acquired it and who they may have exposed. And then we follow up with those contacts to determine whether or not they have symptoms and to advise, require isolation and testing. And make contact with the facility itself in order to determine further actions that are required. So if in fact we've got a school-based outbreak situation, you may have an entire cohort that's identified, a class or a bus that needs, everybody involved would need to be isolated potentially. We determine that through the history taking that we do, and that those individuals would need to be isolated at home and have follow-up testing and monitor for symptoms. And we work with the facility, the school, the childcare center for communication with the people that are affected. We certainly had concern expressed from parents, members of the community with regards to the outbreak at St. Marie of the Incarnation Catholic School in Bradford, West Gwillimbury. And to date, we've had 20 identified cases in this school, all of them students. The majority of them are located in a single cohort. All of them either are identified as having had contacts within that cohort, or other cases in other cohorts, contacts through siblings that are part of it. So back through the home environment as the source of contact. And we've, although had some cases reported in the past week, when we look at the date of onset of those cases, see that the great majority of them had their date of onset in the preceding week. So we are continuing with the isolation of the affected classes, with the testing that's required, and watching to see whether or not these measures are effective in bringing the outbreak to a close, reducing transmission. We are keeping the school open. It is important that where we can keep schools open for the well-being of children in general. The great majority of the classes in this school are not affected by this outbreak. It's a minority of classes that are affected to date. And we are proceeding today with offering testing for those who haven't been identified requiring isolation and follow-up testing. So this is additional testing for those without symptoms or without the contact history. It is optional for them. It's not mandatory, but it would help, I think, reassure people with regards to transmission status and give us more information with regards to the degree of control that we have in responding to this outbreak. So the asymptomatic students, their household family members, and staff and family members are invited to attend a walk-in testing clinic today between 4:30 and 8:30 p.m. So these are people without symptoms. Members of the public, generally speaking, will not be tested at this clinic. This is specifically for the people that are just identified associated with the school. And then students who have been identified as high-risk contacts from a class or bus exposure and are asymptomatic are also invited to attend the clinic between 7:30 and 8:30 p.m. So this is another opportunity for them to obtain the testing that they really require. We are also hosting a virtual question and answer session about the outbreak and its management and the prevention of transmission for the parents of the children who attend this school. St. Marie of the Incarnation Catholic School. So that'll be taking place tomorrow between 7 and 8 p.m. And it'll be hosted by Dr. Colin Lee, Associate Medical Officer of Health with the Simcoe Muskoka District Health Unit, as well as Jason Reevy, who's the school health, public health nurse participating in the response to this outbreak. And for more information, people can go to our website in order to find out about how to connect with that. We've had some questions about the timeline of this investigation. Some people concerned about its duration, its length, perceptions of delay. So it does take time to gather information in a response to an outbreak. People who are cases initially have to self-identify as having symptoms or be identified through screening, and then isolate and obtain the testing, have the test results come back. They're communicated to us from the province, but there can be some delay as those steps unfold. And we target getting in touch with them within 24 hours of receiving the test results. And in most cases, we're able to get to them within 24 hours. And then their contacts within another 24 hours of knowing of them. So that's another step in the process to get that information. And then we need to liaise with the school in order to communicate out to the affected classes that they've been contacts and need to be isolated and need to have follow-up testing and to maintain themselves at home for 10 days after the last contact from a positive case. And certainly if they have symptoms, they need to remain at home. And so this has affected some classes. It's affected, in some cases, an entire class, a school bus, depending on the situation at hand. And disinfection is also required at the site, whether it's a school or a child care center. Once again, I would advise that people need to maintain the protective measures to safeguard the school environment. And this includes getting immunized for those who are all able to do so, and for children to be screened, staff and visitors to be screened, and to isolate, not attend if they're symptomatic. So, in the near future, I anticipate issuing a letter of instruction with regards to the requirement for immunization for facilities outside of schools, not schools, but otherwise facilities that provide sporting activities and events for children and youth. And so we would be looking for evidence, proof of immunization for the coaches, teachers, those providing instruction or officiating at such organized sports or volunteering in any capacity for that purpose. So we don't have that quite ready to be issued, but I anticipate that will be coming soon. And we are consulting with the Office of the Chief Medical Officer of Health about the exact wording of that as required under the Reopening Ontario Act. We note that as of Friday, the province had communicated lifting of capacity limits in select settings. And as of today, we now have the regulations associated with that and are working through creating our resources for premises in order to help them with compliance with this. So in keeping with the government's approach, effective on Saturday, just after midnight, the capacity limits were lifted to allow 100% capacity in the following settings: concert venues, theaters, and cinemas, spectator areas, facilities for sports and recreation, fitness areas, but would not include gyms and personal training, meeting and event spaces, so indoor meeting and event spaces, they would still need such spaces to limit capacity to the number that can maintain the 2-meter physical distancing. Horse racing tracks, car racing tracks, and other similar venues, and commercial film and television production with studio audiences. 100% proof of vaccination will be required for those that attend these events in keeping with the Reopening Ontario Act. And other public health measures would remain, such as masking and physical distancing. As I've indicated, we will be putting up information on our website to provide guidance to these facilities. The Health Unit recently participated in an education and compliance initiative with the province, a multi-ministerial team, police services, and municipal enforcement agencies collectively visiting over 240 businesses during a 3-day period, October the 4th to the 6th, providing education and enforcement. The campaign was for businesses that must request proof of vaccination from their patrons. Businesses visited included restaurants, gyms, and fitness facilities. The top 3 most common issues noted were with regards to the need for screening, capacity limits, and safety plans. So businesses with outstanding issues will be followed up to ensure compliance with the Reopening Ontario Act. Actually, in total, there were 3 charges issued with the multi-ministerial approach in this enterprise. I'm happy to announce that we have a high degree of compliance with the vaccination policy for the health unit, for the Simcoe Muskoka District Health Unit. So this is for our staff, volunteers, and contractors, and documentation on compliance with vaccination, or documentation of a medical exemption, or documentation of a exemption based under the Human Rights Code. We're due on Friday. So when we look at our data now, we note we have 97% of our staff having submitted evidence of vaccination. The remainder fall into the other 2 categories, and we are reviewing what has been submitted with regards to either medical exemption or human rights exemption. So we have the following questions from the media. Why are we seeing an increase in COVID-19 cases with partial or full vaccination? So the vaccines that we have are highly effective, but they are not perfect. And we do see some breakthrough cases associated with COVID-19. A certain number of our cases occur among those that are fully immunized. I think the really important takeaway point is, although this does occur, our data continues to show that those who aren't immunized are 11 times more likely to get COVID-19 and are 35 times more likely to be hospitalized because of COVID-19 compared with people who are fully immunized. So it's a highly effective vaccine or vaccination that we have. I continue to urge everybody who is eligible to receive the vaccine, but because it's not 100% protective, we will see some breakthrough cases. And as we progress in vaccinating an ever larger proportion of the population, we'll have fewer people remaining who are unimmunized. And therefore, the proportion of our cases that are breakthrough cases compared with those that are among the unimmunized or only partially immunized can only go up over time. If there are fewer and fewer people remaining unimmunized, they cannot. There are just fewer people among them to become cases relative to everybody else who is immunized. But the bottom line is, for those that are immunized, are much more protected, much less likely to become cases than for those who are unimmunized. At what point does a health unit decide to temporarily close schools that have outbreaks? So certainly we strive to keep schools open. We strive with the schools and our school boards to have them as safe as possible. It's really a partnership that it involves the parents and the students themselves, the staff, with everything that everybody needs to do to make sure that the school environment is safe. And when we do have outbreaks, we respond to the very best of our ability, as expeditiously as we can, to put in place further precautions to identify the cases and their contacts and have them go into isolation, follow-up testing, and to continue to monitor very closely for any evidence of ongoing transmission elsewhere in the school. So we strive to keep the schools open because it's so important to children's health and well-being to be able to continue to go to school. And we would close schools if it proves to be necessary to control the outbreak. If we are able to keep it out of most of the classes, and we're able to monitor closely and see there isn't evidence of it transmitting in the majority of classes, then we're going to do all that we can to keep it open. If we get to the point where it's the numbers and the size of the cohorts are so large that it's disruptive to the ability of the school to continue, or that we have evidence that there's transmission into new cohorts despite the control measures, then we would consider closing the school. And we would close the school for the shortest period necessary to assure ourselves that we had it under control. And this, I think, would be a part of the rationale for additional testing. So we are doing additional testing in that one school in South Simcoe, St. Marie of the Incarnation, but that's actually being done with PCR testing. The province is making available rapid antigen testing as another way of potentially helping us in situations like that, and we are looking into the potential to do that as well, considering that with the province. Regarding the lifting of capacity limits in spectator areas of sports facilities and concert venues, I just want to touch bases about how they're being applied to township facilities. Township staff say they are awaiting word from the health unit. Is there any direction available currently? So it was on Friday that this was announced, late in the day. Today, we received the regulations associated with this. We are developing our communications to go up on our website and out to such premises. So we've got to work through all of that in order to be able to be in a position to advise everybody affected, including municipalities. And we would also invite contact from those operators to us as well. Though I do need to acknowledge limited phone capacity at this time, but we're doing what we can to get that information up and out. Why are capacity limits increasing at some venues while we're being asked to keep to 25 for indoor gatherings in personal homes? So I would say that the decision to increase capacity limits, to take away the limits, in fact, for these large venues was made by the province. And it, as a calculated risk on their part, so far we've had success over the past month provincially in avoiding increases, in fact, having some decrease in transmission week on week for COVID-19. And so there's certainly a desire to be able to get back to more living, and taking away capacity limits, I think, would be a reflection of the province's response to that kind of desire. I'm very happy that they're continuing with the other control measures, the requirement of proof of vaccination to attend such premises and to use masks and physically distance to the best of ability. I think that we need to take it one step at a time. So they're taking that one major step. They need to wait and see what the impact of that is on transmission. We've just gone through a major family gathering event, Thanksgiving. And in the past year, we had a measurable increase in transmission associated with that. We need to see what comes of that. And that's even with a gathering limit of 25 people in the household. I think we need to take it one step at a time and continue to be cautious and not remove all restrictions all at once at the same time. We need to see the impact of each step that we take. So at this point, I'd be happy to take questions.
Thank you so much, Dr. Gardner, for your update today. We will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Marg Bruneman from Barrie Today?
Sure, thanks so much. I'm interested in your comments and follow-ups on the age group 12 and under. How much of a concern is it for you that close to a third of the local cases are now the age group that can't be vaccinated, and any suggestions there?
Well, it certainly speaks to the importance of immunization, because we are seeing a pattern where it's those who aren't immunized, in the case of young children, can't be immunized, who are representing the majority of our cases. And it really tells you that if we didn't have the high vaccination rate that we have now, we would be seeing many, many more cases than we are now. So my first message would be to those who can receive the immunization but have not yet done so, that they receive it, that it's important for them to protect themselves, that they receive it, but it's also important that they do so to protect others who can't, such as the young children. So when people who are caretakers for young children, parents for young children, staff who work with young children choose to be immunized, they're choosing that protection for those children. I just urge that everybody who can do so take up immunization. It otherwise speaks to the importance of the other control measures to protect children. So we're seeing some transmission in households, but over the past week, the majority of cases are actually in the outbreaks in the schools. So we have to do all that we can to control such outbreaks, to avoid such outbreaks. And when immunization becomes available, supported, authorized for children under the age of 12, it'd be very important for us as a health unit to do all we can to make it readily available. And I would urge parents to come forward and have your children protected, have them immunized.
Do you have a question for follow-up? Mark? Okay, we'll move on. Chris Simon from the Barrie Advance, do you have a question for Dr. Gardner?
Sorry, I was sleeping.
Yes, I do. Dr. Gardner, do you support the removal of capacity limits at large venues? Where I'm just kind of going with that is I can't understand why it's okay to go see a Barrie Colts game with several thousand people, but I can't go to a small intimate restaurant with significantly less capacity.
Mm-hmm. Well, it is a step that the province made, and it's not one in which I was advocating for. I would say I would be advocating for a slower rolling out of that. I am aware that it was under consideration. I'm aware that there was a strong desire, I think, provincially to be able to move with removing restrictions like that. But personally, I would be more cautious.
Okay. I'd like to go back to the letter of recommendation that you say is coming. is that intended as guideline, or will it be mandated?
It'd be a letter of instruction, which means it would be mandatory. And, it's specific for those that are working, what's intended, working with youth and children, that they be, in sporting events outside of the school environment, that they be immunized. So they'll be required. And we would provide a sufficient duration of time for them to be able to do that.
Okay, and sorry, just one other question, if I may. The enforcement blitz that was done earlier this month, the 3 charges that you said were laid, can you provide any details around, I guess, what the fines would be in those cases, or the types of businesses that were charged?
So they would be the kind of businesses that I had cited already. The venues that require the proof of immunization, and in particular, it'd be the restaurants and the gyms. But I actually don't have that information in front of me. I think I'll check with my staff about some of the details of that. We, as a health unit, post the ones that we issue. So we issued 1, and that'll go up on our website, the details on it. The issues of concern were screening or having a safety plan.
Thank you very much.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question? I think you're on mute, Mary Beth.
Second, let's get rid of that and press that. Hey, somebody had mentioned, I don't know whether it was early this week or the week before, but they had called up to the testing center in Huntsville and they were closed, and they were told that was due to staffing issues. Is that kind of an ongoing thing? Should that be a concern for us, or is this being looked after?
If you don't mind, I think I'll look into that and get back to you on that.
Absolutely. My other question is, how confident are we that our region will hit that 90% double dose?
It will take us weeks to be able to get there, but we are making the same kind of progress that the province is making. We're like 1 percentage point behind, about a week or so behind the province, but moving in the same direction. So although it will take us several weeks to do it, I feel that we will. And 1 health unit in this province has actually achieved it. So the Leeds Grenfell Lanark District Health Unit has achieved over 90% coverage for both dose 1 and dose 2.
Something to aspire to. Thank you so much.
You're welcome.
James Bowler from Cogeco, do you have a question today? Okay. Can we go with Brett Glover from Barrie 360? Do you have a question?
Thank you. Yes, I do. We're hearing tales from some of our listeners of kids getting sick with COVID-like symptoms recently, and parents are keeping them home for a day or two, but not exploring these symptoms further to avoid staying home from work for a few weeks themselves. Then these kids are sent back to school within a couple of days once the symptoms go away. No testing being done here, but what's the risk here, if any?
Well, we do expect a certain number of those who receive immunization to have symptoms, minor cold-like symptoms, aches and pains, and not feeling unwell. I think that would be expected, and so not of concern. If they continue to have symptoms beyond a 2 to 3 day period, for sure they need to be investigated. If they'd had a contact with a known case or suspected case, they need to be isolated and tested.
Thank you. And I don't know if you can speak to this, but with talk ramping up about vaccines for kids 5 to 12, I'm wondering about dosage. Would it be less than an adult would get? And would that mean lessened potential side effects?
So in communication with contacts at the province about this, we do expect a completely different formulation, and the dosage would be different from adults. We don't expect that we'd be using the same vials that have been provided to adults. We wouldn't be, say, taking a smaller quantity of it to provide for children. And in fact, we expect new vials, different formulation.
Perfect. Thanks for your time.
You're welcome.
Erica Engel from Collingwood Today. Do you have a question for Dr. Gardner?
Yes, thank you. Dr. Gardner, I was wondering why you are choosing to issue that letter of instruction about coaches and people working with kids in sports. Have there been cases? Is it related to protecting the kids?
It's a very good question. It is about protecting the kids, the youth, but in particular, those who cannot be immunized. So there's requirements for the attendance at events to be immunized, not the youth. They are exempt if they're in such sporting events. But the coaches and the assistants are also exempt under provincial legislation, and a number of medical officers of health across the province feel that, in fact, they should be required to be immunized to protect youth, and in particular, protect those who cannot be immunized, the children. And so it's meant to be an addition of protection.
Do you know when that letter might be issued? And when you said you'd leave enough time, is that like if someone doesn't have a vaccine at all, you'd leave enough time to get one, like first, second dose, and then 14 days?
So to answer your second question, yes, we would allow 6 weeks, which would allow people to come forward, get immunized, wait 3 weeks, get immunized again another 2 weeks. And the date would correspond with that. And we hope to issue it later this week.
Thank you.
You're welcome.
Mike Arcelides from CTV Barrie, do you have a question?
Yes, doctor, hello.
Hello.
With regard to that school in Bradford, is there any indication how the virus is making its way into the homes? Is it parents and those with kids who are unvaccinated, or is that too much into their personal lives?
I think what I would say is child to child sibling interaction within the home would be unavoidable or very hard to avoid. And certainly before the outbreak is recognized would have happened. And so we have a cohort where there is the clustering of transmission in the school environment. And other than that, other classes that are affected from our history taking are connected through the sibling interaction in the home.
So the odds are if one household is affected and they get on the bus and then they go to karate class and then they go swimming together and then they have a birthday party on a Saturday, eventually that virus is going to make its way through those cohorts. Is that what we're suggesting?
Well, that would be a risk for those who are unimmunized, much more than for those who are immunized. And this is an elementary school. And so we are talking about a school where the children are not immunized, can't be. And the scenario that you described is a possible scenario. I think it speaks to the importance of mask use and physical distancing where possible in those other venues, and for everybody who can be immunized in the household and in those venues to be immunized.
And with regard to this event tomorrow, what will be the topic here? Will this be on just calming some of the frustrations, the concerns, and the nerves here? Or will it be sort of an encouragement as well for those who have not taken part in vaccination?
Well, we always encourage vaccination. It's just so foundational. So we take every opportunity to do that. But the primary purpose is actually to address people's concerns, to do what we can to provide information, hopefully to their satisfaction, but to the very best of our ability.
If I could squeeze something in, do you anticipate a school closure before Christmas?
You mean throughout our district? There have been some in the province, but we've been able to avoid that. But then again, the province in the past years closed all schools on occasion when needed. So I would hope that we can avoid it. We will do all that we can to avoid it while still maintaining the safety of school environments. But we shall see.
Thank you.
You're welcome.
Trina Burlow from Creemore Echo, do you have a question for Dr. Gardner? Okay, Mo Fahim from My Muskoka Now, do you have a question today? Okay. Can we go back to Marg Bruneman? I believe she had a follow-up question, but was experiencing some technical difficulties. Marg, are you able to connect?
I am. Thanks so much. Sorry about that. Video froze. Doctor, I am interested in following up on the vaccination for those kids under 12. What's your knowledge of the timeline for the availability or the possible availability of that? And what's your hope? How important is this?
Well, it's certainly important. I'm aware that Health Canada has already received some data from the clinical trials for children 5 to 11 years of age for Pfizer, but they haven't had a complete submission. In communication with contacts who had more information about this at the province, there's the expectation that the remainder of the information and possible approval would occur in November. And after that, we would need to know about the formulation, get approval and support from the province as to how it's to be used, start to receive vaccine. So my expectation would be later in the year or early in 2022. And, I both expect it then, and I'm hopeful that it will take place then.
Perfect. Thanks so much.
You're welcome.
I believe Mo Fahim from My Muskoka Now has a question as well, but is experiencing technical difficulties. Mo, are you able to answer or ask your question?
Yeah, hi, can you hear me?
Yes.
Perfect. I'm sorry if there's any echoing there. I'll just shut off my speaker for a second. So yeah, thank you for taking my question, Dr. Gardner. And in a recent article today on My Muskoka Now, after a discussion with officials from the District of Muskoka, it was clarified that there's currently 200. And I'm just using Muskoka as an example now. The actual question comes after, I promise. There's a point to this. But yeah, there's about 207 current staff member at the Pines Long-Term Care Home. And as of Tuesday, 85% of them are fully vaccinated and 32 staff members are not vaccinated. However, there's also 35 vacancies across all disciplines at the home. So at this, assuming over the next month, by November 15th, when the Ministry of Long-Term Care's mandatory vaccination policy kicks in, assuming no new vaccinations are added, that means the Pines Long-Term Care Home is looking at a significant operational challenge there with staffing. So how do you feel about that? Any recommendations? Any comments?
Well, certainly I support the province's requirement for immunization for staff in long-term care facilities. That's been a very vulnerable sector to outbreaks, and even now it's possible to have outbreaks with the immunization. It's one of the reasons why we proceeded with third dose provision for the residents in those facilities. And staff can be a means of bringing in COVID-19 into the facility, and you can have a cluster among staff as well if you don't have high vaccination coverage. So important to get a very high vaccination coverage among staff, and encouraged among the visitors as well, I would say. And certainly you want it very high among the residents. I know that this is unique in history to require this, to move in the direction of having this kind of requirement for an entire sector. And so we have to wait and see exactly how it all unfolds without the hindsight of history to be able to draw on. I actually feel confident, though, that in most instances, you will get a sufficient amount of compliance that you'd be able to avoid undue hardship for the facility to be able to operate, because I think most people at the end of the day will choose vaccination in order to be able to continue to work. I believe in the end, although time will tell, but I believe in the end that will be the outcome.
Do you have a question for follow-up, Mo?
Thank you. No follow-up question. Thank you so much, Dr. Gardner.
You're welcome.
Mark Claremont from Muskoka Today. Do you have a question for Dr. Gardner? Okay. And we'll go over to the phone line today. Are there any? Oh, hello.
Yeah, I had trouble turning off my unmute there. Dr. Gardner, are all hospitals in Simcoe Muskoka, is there a mandatory vaccination order in place?
There's no, well, there is Directive 6. It requires hospitals throughout Ontario to have vaccination policies that requires staff to be immunized or have proof of medical exemption, and they're very specific about what would be a bona fide medical exemption, or to undergo serial testing and education about the importance and safety of vaccination. So all hospitals have to comply with that. And the majority of hospitals throughout Simcoe Muskoka have gone beyond that to make 100% coverage their goal and to have mandatory immunization policies with leaves without pay or termination as an outcome for those that don't comply.
Okay, thanks. Regarding also the LTC, if my memory serves me correct, was it by last May that the most LTCs and retirement and congregate places had their second doses? I'm just wondering, we must be at that point 6 months post the second dose that you'd be looking to see whether or not, I know you mentioned, referred to third booster shots and things like that. Is that something you have to plan for? And are you concerned about that the breakthrough could happen 6-8 months after?
It's certainly an important topic, and we have followed provincial direction in providing third doses by their original direction 5 months out after the second dose, and did that in September for our long-term care facilities and what were deemed to be high-risk retirement homes and the elder homes. And now with recommendations from the National Advisory Committee of Immunization, we're providing such doses for the remainder of the retirement homes. So it's certainly an important priority for us to carry that out.
Yeah, you should be easily able to track those people. You don't have to ask for voluntary participation because you certainly they're dare I call it a captive audience there, right? Because I read something this week that Moderna's concerned that the efficacy of their vaccine, certainly Moderna, I'm not sure about Pfizer or any of the other ones, after it wanes after 6 months.
So everybody who receives the immunization we need their free and informed consent to be able to provide it. And if they aren't able to give it because they don't have the capacity to do so, then of a surrogate care individual in their family. We certainly abide by that requirement. And that is very much the case for those that are in facilities as well. With regards to waning immunity, that's a topic of ongoing research. The most recent body of research suggests that we have strong long-term immunity, at least for 5+ months. For the general population, we need to see going forward how much longer that lasts, but that's what we've got so far. This would be in particular for both Pfizer and Moderna, the mRNA vaccines. When it comes to those who are more vulnerable, the residents of long-term care facilities, seniors living in congregate settings, there is data showing that they do have a drop-off in immunity going out 6 months and beyond, and that the effect of a drop-off is actually greater with Pfizer than Moderna. Regardless, we have this recommendation from the National Advisory Committee Immunization and direction from the Ministry of Health to provide immunization to the residents of these senior congregate settings.
Good. Thank you very much, Doctor.
You're welcome.
We'll go over to the phone line. Are there any questions today? Okay. And we just have one more question from Mo Fahim. It's a written question. He asks, what happens if that's assuming vaccinations keep rising, but what if this policy starts being detrimental in a negative way in staffing or for long-term care homes or healthcare as well?
I think we need to take one step at a time and see how things unfold. Right now, we have direction that we're following, and I support it. With regards to immunization, policies in hospitals and requirement for immunization in long-term care, I expect, it's also have certain requirements for schools and other certain congregate settings. So I expect that there'll be more of such direction from the province. I think we learn as we go with regards to the impact of that, the degree of compliance with that, the challenges that may arise with it, and the effectiveness of it. So I think we need to continue to learn from our experience and adapt practice based on what we learn.
Thank you, Dr. Gardner.
You're welcome.
I'm very mindful of the time, but I just want to ask if there is anyone who did not have the opportunity to ask their question this afternoon. Okay. Well, I believe that brings us to the end of our media briefing today. Dr. Gardner, thank you so much for your update, and I'd like to thank the members of the media for their participation as well. Our next media briefing will be Wednesday, October 20th. Thank you so much.
Bye, everybody.
Thank you.
Just before you go, can I ask one thing of you, Dr. Gardner?
Recording stopped.
It's just about the Q&A session with Dr. Colin Lee. I couldn't find the information on the website, so I just wanted, is it virtual? Do you need a Zoom link or something?
It is virtual. I said it was on the website. I must admit, I had thought it was. Let me look into that and see, okay? And we'll get back out of communication to you about it.
Perfect, thank you.
You're welcome.
Flow of writing, or did it just come naturally using the pandemic as a source?
I actually haven't written a song this whole pandemic.
Okay.
I found that it was interesting. I wasn't playing live in public, but I was playing live online so often that it gave me more time